So these are your equine muscles from the table that is on advanced therapeutic techniques. So I'm just going to read through the muscles that you've got on here for you to learn. So first of all, we've got the masseter muscle. The origin is the facial crest and the zygomatic arch, and inserts onto the ramus of the mandible. The action is mastication and elevates the mandible and presses it against the maxilla. The innervation is the masticatory nerve from the mandibular nerve. Next one is the rectus capitis, dorsi major e minor. The origin is the axis and the atlas, and inserts onto the nuchal crest and the occipital bone. It elevates the head, and the innervation is the dorsal branch of C1. Obliquus capitis cranialis. The origin is the wing of the atlas, inserts onto the nuchal crest and the mastoid process. Extends the head or flexes it laterally, and its innervation is the dorsal branch of C1. Splinalis. The origin is the spinous processes of T3 to T5 via the thoracolumbar fascia and the nuchal ligament. And the insertion is the nuchal crest and the mastoid process, and the thoracic processes of C2 to C5. The action is it elevates and extends the head and neck and bends laterally. The innervation is the dorsal branches of the local spinal nerves and the dorsal branch of the accessory. Trapezius. The origin is the nuchal and the spinous ligaments from C2 to T10. The innervation is the thoracic part of the first third of the scapular spine, and the cervical part is the entire scapular spine. The action is it elevates the shoulder, draws the scapula craniodorsally and chordodorsally. The innervation is the dorsal branch of the accessory nerve. Sternocephalicus is the manubrium sternum. Insertion is the caudal ramus. Action is it opens the mouth, flexes or inclines the head and neck to the side of the muscle, and the innervation is the ventral branch of the accessory nerve. The next muscle is the rhomboideus. The origin is the nuchal and dorsal scapular ligaments from C2 to T8. The insertion is the medial scapular cartilage. The action is it elevates the head in stance and flexes the neck in use. Innervation is the medioventral branch of the local thoracic and cervical nerves. The next three muscles make up the brachiocephalicus muscle in the horse, which is different to the dog. So this is the cleidomastoideus, the omotransversarius, and the cleidobrachialis. So the first muscle is the cleidomastoideus. The origin is the clavicular intersection and inserts onto the mastoideus process of the temporal bone. The action is it protracts the limb and flexes the neck, and its innervation is the ventral branch of the accessory. The next muscle is the omotransversarius. The origin is the shoulder fascia and inserts onto the thoracic processes of C2 to C4. Its action is it protracts the limb and flexes the neck, and the innervation is the local cervical nerves. Cleidobrachialis. The origin is from the clavicular intersection, inserts onto the crest of the humerus and advances the limb. The innervation is the local cervical nerves. So they are the three muscles that form the brachiocephalicus muscle in the horse. The next muscle is serratus ventralis, cervicalis and thoracics. So it originates from the thoracic processes of C4 to C7 and the first 8 to 9 ribs, and inserts onto the facies serrata. Its function is to suspend the trunk. It raises the neck when the forelimb is fixed and also supports on inspiration. Its innervation is the ventral branches of C5 to C8 and the long thoracic nerve. The next muscle is the subclavius. Its origin is the sternum and the costal cartilage 1 to 4, and it inserts onto the supraspinatus. It sort of blends with it and the shoulder fascia. Its action is it suspends the trunk and stabilises the shoulder joint, and its innervation is the cranial pectoral nerve. The next muscle is the supraspinatus. Its origin is the supraspinous fossa and the spine of the scapula, and inserts onto the greater and lesser tubercles of the humerus. It extends and stabilises the shoulder joint, and its innervation is the suprascapular nerve. Infraspinatus is the infraspinatus fossa and the spine of the scapula. It inserts onto the greater tubercle of the humerus. Its action is to extend and fix the shoulder and stabilises. It also functions as a collateral ligament, and its innervation is the suprascapular nerve. So the pectorals, so you've got there's ascending pectorals, which is the anterior and the superficial. They originate from the nubrium of the sternum and insert onto the deltoid tuberosity and the crest of the humerus. They connect, so its action is it connects the forelimb with the trunk and abducts, and retracts the forelimb, and its innervation is the cranial and caudal pectoral nerve. The transverse pectorals, which is the superficial again, forms part of the, originates from the costal cartilages 1 to 6 and the adjacent sternum, and inserts onto the forearm fascia. It connects the forelimb with the trunk, acts as an abductor, protractor and retractor of the forelimb, and is innervated by the cranial and caudal pectoral nerve. The descending pectorals, which is the deep pectorals, originates from the sternum, distally on the ribs 4 to 9, and the trachea flavia abdominis, I think I've said that right, inserts onto the major and minor tubercles of the humerus and the tendon of the cobrachialis. Its action is it retracts the forelimb, suspends the trunk between the forelimb, and stabilises the shoulder joint. It is innervated by the cranial and caudal pectoral nerve. When we've got the triceps brachii, so the long head, comes from the caudal scapula, inserts onto the olecranon, flexes the shoulder and extends the elbow, and is innervated by the radial nerve. Then we've got triceps brachii lateral head. It originates from the humerus and the deltoid tuberosity and inserts onto the olecranon. It extends the elbow and is innervated by the radial nerve. The next muscle is the biceps brachii. It originates from the supraglenoid tubercle and inserts onto the radial tuberosity, medial collateral ligaments, onto the tendon of the extensor carpi radialis. Its function is to extend the shoulder and carpus and flexes the elbow, and is innervated by the musculocutaneous nerve. The deltoideus originates from the scapular spine and the caudal scapula and inserts onto the deltoid tuberosity and flexes the shoulder. It is innervated by the axillary nerve. Latissimus dorsi originates from the suprascapular ligament from T3 caudally via the thoracolumbar fascia and inserts onto the teres major tuberosity. Its action is lateral flexion of the back, shoulder flexion, and retracts the limb and draws the trunk cranially, and is innervated by the thoracodorsal nerve. Longissimus costorum originates from the lumbar thoracic processes and the cranial rib borders, and inserts onto the angles of the ribs 1 to 15 and the thoracic processes of C7. It stabilises the lumbar and the ribs and extends and laterally bends the back and is involved with expiration. It is innervated by the dorsal branch of the local spinal nerves. Tensor fasciae lata originates from the tubercocci and inserts onto via the fascia lata on the lateral patellar ligament, cranial border of the tibia, with a superficial gluteal on the third trochanter. It flexes the hip, protracts the hind limb, and extends the stifle and tenses the tensor fascia, and it's innervated by the cranial gluteal nerve. Then we've got longissimus dorsi, which is made up of a lumborum, thoracics, cervical, capitis, and atlantis part. It originates from the ilium, the sacrum processes of the sacrum, lumbar, and thoracic vertebrae, and then the thoracic processes of the thoracic and cervical vertebrae. It inserts onto the thoracic processes of the vertebrae, tubercles of the ribs and wing of the atlas, and the mastoid process. Its action is it stabilises and extends the back and is involved in lateral flexion and is innervated by the dorsal branches of the local spinal nerves. Then we've got the gluteal medius. Its origin is the longissimus lumborum, ilium, sacrum, and sacroiliac, and the sacrosciatic ligaments. It inserts onto the greater trochanter. Its action is it extends the hip and abducts the leg, and its innervation is the cranial gluteal nerve. Biceps femoris is made up of the spinous processes of sacrum 3 to 5 and the sacrosciatic ligament, tau fascia and tuber ischium, and inserts onto the lateral patella and lateral and medial patellar ligaments, cranial tibial, crural fascia, tarsal tendon to the calcaneus. Its action is it extends the hip and stifle and flexes the stifle, abducts the limb and extends the hock, and is innervated by the caudal, gluteal, and sciatic nerve. Semitendinosus comes from the sacral 5 and the caudal 1 and 2. Tau fascia, sacral sciatic ligament, and ventral tuber ischium. Inserts onto the cranial border of the tibia, crural fascia, and tarsal tendon. It extends the hip, stifle, hock in stance, and flexes the same in protraction and retraction, and abducts the limb, and is innervated by the caudal, gluteal, and sciatic nerve. Semimembranosus comes from CA1, the sacrosciatic ligament, and the tuber ischium, and inserts onto the medial condyles of the femur and the tibia. Its action is in stance. It extends the hip and stifle and retracts and abducts, and inward rotation as well, and it is innervated by the caudal, gluteal, and sciatic nerve. Vastus lateralis, its origin is the proximal lateral femur and inserts onto the intermediate patellar ligament to the tibia. It flexes the hip, extends and stabilises the stifle, and its innervation is the femoral nerve. Gastrocnemius is the medial and lateral supracondylar tuberosities of the femur and inserts onto the common calcaneal tendon. Its action is it extends the hock and flexes the stifle and is innervated by the tibial nerve. Gracilis comes from the pelvic symphysis, inserts onto the crural fascia and the medial patellar ligament and the cranial tibia. It abducts the limb and extends the stifle, and it's innervated by the obturator nerve. Pectineus comes from the pubis and the contralateral iliopubic eminence. It inserts onto the medial femur, abducts the limb and flexes the hip, and is innervated by the obturator and the femoral nerve. The supradigital flexor originates from the medial epicondyle of the humerus and inserts onto proximal and medial phalanges. It flexes the digits and the carpus and extends the elbow, and is innervated by the ulnar nerve. The flexor digitum profundus originates from the medial epicondyle of the humerus, medial olecranon and caudal radius, and inserts onto the flexor surface of the digital phalanx. Its action is to flex the digits and the carpus and extend the elbow, and is innervated by the median and the ulnar nerve. The intraosseous or suspensory comes from the proximal caudal on metacarpal 3 and the palmar carpal ligament. It inserts onto the proximal sesamoid and branches to insert onto the common digital extensor. It counteracts override extension of the fetlock and is innovated by the ulna. Its common digital extensor originates from the radius, lateral epicondyle of the humerus and ulna, and inserts onto the proximal dorsal and proximal medial and distal part of the phalanges. It extends the carpus and the digits, and it is innervated by the radial nerve. And then we've got the lateral digital extensor, which comes from the proximal radius and ulna and inserts onto the proximal part of the medial and distal phalanx. It extends the fetlocks, not the digits, and it is innervated by the radial nerve. There we go, that's all your equine muscles as they are on Marigold's handout. Many thanks, bye.